Javin, Brita. I'm the physician assistant with the Yale Survivorship Program, and I want to welcome all of you to the Smilow Shares webinar tonight on cancer myths and social media. We'll get started here in just a moment. I want to thank you all for joining the four of us tonight for taking the time to talk about some of these cancer myths and learning what you can about what truths are out there, and hopefully also how to decipher between some of these myths that float out there on social media. So I just want to remind everybody, you can interact with us. You can put questions and questions into the questions and answers chat box or the main chat box for us to review. We're going to reserve answers for all the questions until after we're done with our brief presentation on cancer myths and social media. I also want to remind everyone that this session is being recorded and will be available up on YouTube as well. Smilow as a cancer hospital, we will post about that so you're aware of how to access that. Without further ado, then we'll get started here. I'm going to share my screen for our presentation on cancer myths and social media. Okay. So I wanted to start first by talking a little bit about our titles here. And we thought it would be a great place to start and with some introductions. So I'm going to go around and everybody will introduce themselves and what we do at Yale. My name is Javin Brita. I am the physician assistant at the Yale Survivorship Program, and I also work at Smilow Breast Center. And my title is, exactly as I mentioned before, physician assistant. You might see the PAC. The PA, as you might imagine, stands for physician assistant, and the C stands for certified. And with that, I will pass it over to Scott.
Thanks, Javin, and thanks everybody for joining us tonight. Appreciate you all being here. I'm Scott Capozza. I'm the physical therapist, part of the Smilow Survivorship Clinic, and I am also Yale New Haven Hospital's only board-certified specialist in oncologic physical therapy throughout the network. So what that means is, in addition to being a licensed physical therapist for over 20 years, that I took the extra step to become board certified by the American Physical Therapy Association to become a specialist in oncology physical therapy. Within the physical therapy world, there are different specializations such as orthopedics and pediatrics and neurology. But now that there's board certification for PTs who want to specifically specialize in working with patients with cancer, and that's what I have done. With that, I'll pass it over to Natalie.
Thanks, Scott. So hi, everybody. I'm Natalie. I'm the oncology dietitian for the Survivorship Clinic at Smilow, and also the integrative medicine team at Smilow. And similar to Scott, you know, we have these credentials at the end of our name that many people don't know what the letters stand for. So it's a great reason for us to just explain, so that when you're looking online and seeing social media posts, you can look for these credentials to make sure that the person you're following has, you know, the background to really back that up. So MS Masters for me, RDN stands for Registered Dietitian Nutritionist, meaning we had to undergo 4 years of an undergrad program with 2 additional years of clinical rotations and then sitting for an exam. And then CSO stands for Certified Specialist in Oncology. And again, that's an additional certification similar to Scott. So you have to have a certain number of hours, I believe 2,000 hours or so in oncology, and then you sit for an additional exam certifying you as a specialist in that. So I believe there's like 20 or 25 CSO dietitians in the state of Connecticut. So it's definitely, you know, a higher level of oncology certification for patients. And I will pass it over to Bridget.
Thanks, Natalie. Hi, everyone. Thanks for joining. I'm Bridget Komosky. I'm also a dietitian, and I work for Smilow Cancer Hospital, located at St. Francis Hospital and Glastonbury. So it can kind of be a little confusing, but I am work for Smilow Cancer Hospital, but Smilow has teamed with St. Francis Hospital in Hartford, and we have a cancer center there. And also in Glastonbury is a small infusion center. And just same as Natalie was saying, I'm a dietitian. So the MS means master's, RD, registered dietitian, CDN, and licensed in the state of Connecticut. And just again, as Natalie was saying, a dietitian is different from a nutritionist. So again, looking at people's names to assess kind of their credentials and did they go to school to do what they do is important. And I'm excited about tonight, and thanks for joining.
All right, thanks so much, everybody. Appreciate that. And I hope you got an idea of who we are and what our initials all stand for. It makes a big difference to know that information, and you'll see some of that highlighted in our presentation here. And we're going to start jumping in with some of these myths that you might see or hear about, and we're open to hearing about any that you might have at the end of the presentation today and answering any questions that we can. So without further ado, let's jump in. So the first myth I wanted to discuss with everyone was there's nothing a cancer survivor can do to help reduce the risk of recurrence. And that is so far from the truth. There are so many modifiable risk factors that a cancer survivor is in control of to reduce the risk of cancer occurrence or recurrence. First, one that might be obvious to a lot of people here is smoking cessation, or never smoking in the first place if you have never smoked before. And there are so many cancers, among other health conditions, that can come from smoking. Basically, you name it, it can happen from smoking in a large part. So that's something I always remind people, if they do smoke, it's the #1 most modifiable risk factor for risk reducing behavior that you can take in reducing the risk of cancer recurrence or occurrence. I also want to talk about limiting alcohol intake because that's something we're seeing more and more literature on, especially with moderate to severe alcohol consumption on its link to cancer occurrence. And that there are multiple cancers that can lead to as well. So we always try to counsel on a moderate amount or a smaller amount of alcohol intake at most, and trying to moderate that yourself. So our dietitians can talk about this in much more detail, of course, but we really try to emphasize that. And we see some of the guidelines changing on that probably in the near future in terms of the amount to consume. Weight management is another thing you can focus on as well. And that comes through appropriate nutrition and physical activity. And so making sure you're being mindful of where you're at with both of those things. You want to come up with a sustainable plan to keep up with healthy eating and routine physical activity. And we know that there are at least 13 different cancers that benefit from physical activity and exercise and reducing the risk that they can occur. So it's really important to keep that in mind. We know that even, for example, with breast cancer, and I'm going to toot that horn here, working in breast cancer myself, that we know that both triple negative disease as well as estrogen-driven breast cancers are helped by weight management and reducing obesity risk. So weight management is certainly something that can help with reducing cancer occurrence. Cancer surveillance is important, of course, too. And these are things that you're in control of doing to watch for any new findings that might come up that need to be further worked up. Those things include going for routine colonoscopies at least every 10 years, sooner if there are any concerning findings or if you have a family history of colorectal cancer. Going for pap smears every 3 to 5 years if you're a woman between the ages of 21 and 65. going for total body skin exams, either through your primary care provider or seeing a dermatologist for that. And in addition to that, making sure you're protecting your skin when you plan to be outdoors in the sun or otherwise. UV rays don't care about clouds, believe it or not. So using an SPF for sunscreen with an SPF of at least 30 is important. And you can use physical barriers like long sleeve shirts, pants, hats, and sunglasses. Keeping up with prostate exams if you're a male as well. And going for annual mammograms if you're a female. Those start at age 40 for women, and prostate exams age 40 for men. For the next point here, health maintenance as well is something to keep an eye on, and that's something you can do just with your primary care provider, going for routine labs, physical exams at least once a year, and keeping up with vaccinations. Believe it or not, there are certain viruses out there that can lead to certain types of cancers. Viruses like HBV, hepatitis B virus, or HPV, the human papilloma virus. Those vaccines are important to keep up with, as well as others, to help with overall health maintenance. And then, of course, something that's well within your control is reporting concerning signs or symptoms that are new, that are persistent, or anything that you might be worried about that's not getting better despite efforts to manage over time. That's something you should report to your oncology provider, or at least your primary care provider, to let them know that might be happening. And with that, I move on to our next myth here. Cancer survivors are at fault for causing their cancer. A lot of people might ask, why did I get my cancer? And maybe even blame themselves. The truth of the matter is, it's more often than not the individual's fault. There's not always a clear reason for the cause of cancer. There are many modifiable, risk factors to address, of course, some of which I just mentioned. But there are lots of mechanisms by which other cancers, cancer can occur by other means. I list some here, some inflammatory cytokines, insulin and IGF-1 release factor, hormone production with estrogen and other androgens, and so on. While some of those are, modifiable with some of the things I mentioned, like reducing risk of obesity through weight management, that's just one example. There are a number of oncogenic signaling pathways, as you can see here on the right, and I expect everyone to memorize every single pathway here. No, don't do that. It's more for an example. So I'm just kidding, don't memorize it. But the idea is that these are just a few of potential pathways by which cancers can occur. It's not every cancer, but some of them are highlighted for certain types of cancers. And this is not something that you are in control of. A genetic predisposition is not something you are in control of. And so these are things that I want you to keep in mind when questioning if you might have caused your cancer. There's not always a good reason. We have people who come in who have very healthy eating and exercise habits. They're triathletes. They never did any recreational drugs. They don't use alcohol. They really live a healthy life, and they get cancer. There's not always a good reason for it, and there's not always a clear reason. All right, and the next thing I wanted to talk about was what you might call the big C. It used to be the term back in the day from what I've heard, and there was even a show about it, I think. But the myth is that cancer is a death sentence, and that's so far from the truth. There are many curable cancers out there, and you can have many good quality years of life even with metastatic cancer. And to highlight that, from 2015 to 2019, cancer death rates have decreased 2.3% per year on average for men and 1.9% per year on average for women. And that's largely in part because there's greater access to screening and care. And you might say, well, what does that have to do with it? Well, it's because we're catching cancers earlier. They're not as late stage or advanced stage or metastatic, that is. And so we're able to treat them curably and make sure people can go on and live their lives thereafter. And there's also been a decrease in smoking rates. So we're actually seeing that correlating, and again, highlighting the reason I say it's the #1 risk-reducing behavior you can take. We're correlating those decreases in smoking rates with more curable cancers and longer living people who have had a history of cancer. And in particular, some of those greatest decreases have been in lung cancers and melanoma, two previously higher mortality cancers. So I just wanted to drive home that point there, and also the fact that even among young adults, we're seeing a decrease in cancer death rates as well. So that's all been very good. And with that, on the other end, we're seeing an increase in our survivor population. As of right now, there's about 18 million cancer survivors out there in the United States. And that's 5% of the United States population. That's no small number. And by 2040, that number is projected to balloon up to 26 million. And that's owing itself to better treatments, more screening, and healthier lifestyles. In addition to that, we're seeing an older population with cancers and people living longer. You're seeing people living 10 or more years, 20 or plus years. And people are living longer, older lives as a result. And you can see that from this pie chart here on the left side. The majority of people who are cancer survivors are 65 or older. And in addition to that, this is a further breakdown. You can definitely see that here between 60 and 80 years old even. That makes up the majority of the chart. And so again, it's just a testament to people living longer lives after having cancer. And in addition to that, we're seeing people living with metastatic cancer longer as well. That ranges from 30% with lung cancer up to 71.8% with bladder cancer in terms of the number of people living with metastatic disease. And there are increases across the board in 1 and 5 year relative survival rates. And you can see that highlighted here from some of the charts on the right. And while, a lot of people with metastatic disease, do live under 5 years, there are lots that have been studied living beyond that, 30% with metastatic melanoma, 20% with colorectal and breast, and even more living with metastatic disease beyond 10 years. So people can live with metastatic disease, certainly 5 years or longer. And as a matter of fact, a recent publication that came out this year showed that by 2040, it's projected that by that time, 46.7%, there will be a greater odds of 46.7%, I want to let that sink in, of long-term survival compared to 2013. So these better treatments, more targeted therapies, all of this are contributing to people living longer, even with metastatic disease. And I want to leave you with some resources, trustable resources you can get here from the National Cancer Institute, from ASCO, from the American Cancer Society. There's a CDC website on occupational carcinogens. And Dana-Farber Cancer Institute up in Boston, they actually have a podcast on myth busting, what we're doing here tonight, hopefully. And you can go to that website and look at some of the podcast, or listen to some of the podcasts on maybe some myths that you've questioned. But feel free to ask as well. Feel free to chime in the chat, chime in the questions and answers, and we'll get to those right after. With that, I want to turn it over to Natalie.
Thanks, Javin. All right. So just to start off, it was very difficult for me and Bridget to narrow this down to 2 myths because, as many people know, there is so much misinformation out there about nutrition. So I think the majority of our job sometimes feels like we're, myth busters all day long because we're just having these conversations with many, many patients. So that's why we wanted to open up at the end to really, open it up to you and let you ask us what those questions you have that are burning, that you really want to know the truth about. So our first nutrition myth is taking herbal and or vitamin supplements will reduce my risk of cancer. And Truth is, there's no research stating that supplements can prevent or cure cancer. However, we know that improving our diet and eating more nutrient-dense foods like fruits and vegetables and lean protein can improve our health and reduce our risk of many types of cancer. Go ahead, Javin. All right, so I always talk about this synergy effect or this synergy of food. And it means that food works better together. So instead of taking different supplements and removing that one vitamin or removing that one nutrient or mineral out of the food and putting it into supplement form, we want people to consume the whole foods and consume them together, because we know that consuming a tomato with broccoli is going to enhance the absorption of those nutrients. We know that turmeric, when combined with black pepper, enhances the effect and absorption of turmeric. So instead of taking a turmeric capsule, we want to teach patients to actually cook with turmeric and actually sprinkle some black pepper on top to then enhance that effect of it, and get back to that whole food approach of nutrition and vitamins. Another example of synergy of food is vitamin C and iron. So many of our oncology patients are iron deficient because of chemotherapy, because of absorption issues, so many causes. And a really cool tip that we give them is, hey, eat some vitamin C rich foods with your iron sources. So if you're having a spinach salad, if you're having beans, if you're having, chicken, pair that with clementines or a citrus vinaigrette or oranges to try to enhance that absorption of iron in our body. And the third is vitamin D and calcium. We know many times supplementation combines the two for a reason, right? Vitamin D helps us absorb calcium, helps strengthen our bones. But again, going back to food, maybe incorporate eggs with some almonds, combining those at breakfast to try to enhance the absorption of both instead of looking to the supplement to do that for you. A reason we try to limit our supplement use and go with food first is because supplements can compete with medications. They can either enhance or inhibit the medication. So sometimes it can increase the levels of the medication in the body, so we're not able to get rid of that and excrete it. So symptoms and side effects can increase from medications. But a good example is milk thistle. Many patients are actually asking the question, should I be taking milk thistle to improve my liver function? Should I be taking it for this reason? One example is that milk thistle can actually reduce the effectiveness of aromatase inhibitors, which breast cancer patients can be on as a hormone blocker, for estrogen positive breast cancer. So without knowing, it seems harmless. It's this pill that has all these claims of being helpful. But when we look at the whole picture and we're looking at what medications you're taking, what cancer medications you're on to increase your longevity and increase the length of your life, is it worth the risk? Excessive supplementation can lead to toxicity and other deficiencies that might not be so common. So one example is zinc, and that's a big one that I've been seeing patients taking more and more lately. And people are on, 200, 300 milligrams of zinc a day, which is well over the recommended amount for us. So one risk of taking zinc long-term is it can lead to a copper deficiency, which is definitely more rare, but we're seeing that more and more. So really for zinc, we don't want to supplement longer than 6 months, and that would only be supplemented for a deficiency. If you're tested for zinc and it shows you're low, then we would supplement for a short period of time to correct that. Another interesting one is turmeric. Again, I go back to that because we're seeing so many patients taking it because there's so many claims of, it has antioxidant properties and it helps with inflammation and joint pain and all these, great things. And yes, that may be true, but there are estrogenic properties in turmeric, right? So for people with estrogen positive breast cancers, that would be something we would want to avoid because that could potentially counteract what we're trying to do with suppressing the estrogen production in the body. And then another one is B6 toxicity, which isn't talked about, as often as I feel it should be, but many patients are on like a mega B complex and a multivitamin and an additional B vitamin, right? And what we want to pay attention to is how much are you getting of that vitamin in each of those supplements? So you want to combine that and see what you're getting. And we can actually overdo B6, so it can build in the muscle. And it can actually, increase your risk of extremity weakness and, some neurological changes. So it's important to understand what you're getting, what you're taking and combining all those supplements to really see what you're taking as a whole. And don't get me wrong, there is a time and a place for supplements. We use supplements to correct deficiencies. We use them to manage side effects. So there absolutely is a time and a place for it. We're just showing that there can be a side to it that we want to be very cautious because they're not regulated as food is in America, right? There's all these supplements out there. They're all over the shelves, and we really need to understand what we're watching for and just being careful. So all in all, more is not better, right? So we think, okay, antioxidants are great for us. So let me do all these antioxidant supplements. Let me take 1,000% of the daily value for vitamin C, and then 10,000 times what I need for acai berries and goji berry and all these different things, right? But the truth is that more isn't better, and sometimes excessive intake of supplements and vitamins can lead to other illnesses and diseases. Getting it from the real food, you don't risk overdoing it because it's a safe and moderate amount of that vitamin that your body is able to absorb and actually, handle. We want to utilize whole foods to obtain micronutrients. Again, going back to the food synergy, an apple doesn't just provide one thing. It provides fiber, it provides antioxidants, it provides soluble fiber. It's got all these amazing qualities combined in that food, which helps provide the additional benefit for your health. Always inform your medical team about what you're taking. So often, you go into a doctor's office and they say, what medications are you taking? And patients, list off their blood pressure medication and their diabetic medication and, their hormone blocker for their breast cancer, but they don't mention the other 10 supplements they may be taking. And it's so important to bring that up in the conversation so your doctors and your team know exactly what you're taking. We want to make sure that there's absolutely no risk. And there should just be that transparency between the two and having an open conversation. Don't be afraid if you're not taking the right thing, just be open with your provider. And I just want to encourage people to think, okay, instead of saying, what supplement should I be taking? Maybe think, what should I be eating? What can I do to enhance my diet? And Bridget and I, we do this in all of our counseling. We assess what you're getting in your diet and we make changes. We say, okay, you're lacking in fiber. Let's increase your fruits and vegetables. You're lacking in zinc, or you're lacking in iron, or, and we can come up with ideas to get that from food first. So instead of going to the supplement immediately, try food first and then see where that goes. I wanted to put this picture up here because so often people ask, well, which multivitamin should I take? What's the best multivitamin? And though there's tons out there, so I can't really narrow that down in this talk today, but I want you to be aware of what USP certification is. You see this like little green and yellow stamp on some products, and you'll see it on the Nature Made bottle. And what this stamp means is that this product was verified by a third party. So as I mentioned before, the FDA does not regulate supplements as they do food. So it's important for these other third party companies to come in and test these products to actually say, yes, what's on that label is truly inside that bottle. What you're taking is accurate. There's no cross-contamination. There's no heavy metals. So it's important to see this stamp to show that somebody else has come in and double-checked the work and making sure that what you're purchasing is accurately what you think you're getting. I just wanted to show an example of the Nature Made multivitamin on the back. So when we talk about getting enough of vitamins and minerals and trace elements and all these great things, you want to pay attention to that % daily value that's right next to these vitamins. So you'll see on here, it says, I know it's a little bit small, but vitamin A, 83% of the daily value, vitamin C, 67%, and it goes down the list. And I think for a good multivitamin, you want around 100% of the daily value at most for all these vitamins and minerals. Going over 100% just means that it's more than your body needs. And truthfully, you should be getting most of these things from your diet. So you don't really need 100%, but it's just keeping it, in moderation. So that's what we want to pay attention to, is that % daily value to say 100% across the board. And if it's exceeding that, it's probably not necessary. We wanted to put this up here just as kind of the opposite end of the example, because there's so many of these out there. I've never actually heard of this type of multivitamin, but again, you learn something new every day. So this one is called Snack Multivitamin. And as you'll see, there's no USP label on this showing that it was verified. So it's kind of just, we're trusting what it's saying. So I'm just going to move my picture so I can read it. So as you can see, we're over here where it says % daily value. For vitamin C, it says 333%. For thiamine B1, it says 1600%. For riboflavin, it says 1400%. For vitamin B6, it says 1250%. B12, 833%. So again, these are 8, 12, 16 times the recommended amount that we should be getting of these vitamins. So it's just something to pay attention to and be mindful of. And just to end this supplement myth, here are some resources that I hope you utilize. And I know there's not too much available to the public online. It's a lot of behind the scenes, myself and the pharmacist within the integrated medicine team, which I'll talk about again. We have access to different search engines and different things that we can actually input the supplements and the vitamins and medications into a cross-check to see what those interactions could be. But if you're interested in what vitamins and minerals you need and how much of those things you need, you can go to the National Institute of Health and look at the Office of Dietary Supplements website. And if you click on this link here at the NIH, it'll take you to the DRI, which is the Dietary Reference Intake, meaning it tells you how much of the vitamins and minerals you need based on your gender and your age, because we know that what a 19-year-old male needs is different than a 70-year-old male, and what a 30-year-old female needs is different than a 60-year-old female. So go to that site if you're looking to find out how much iron you need, how much calcium you need. I think it's a great resource. Also, the MSK, the Memorial Sloan Kettering Search About Herbs website is really cool. We actually use it on the dietitian team at Yale. And you can go to that site, you can Google it, you can go to the site and enter in your vitamin, your herb, your supplement, or, that you're taking, and it will give you a nice little breakdown of, how it works, what it's used for, the benefits of it, patient warnings, and then also like herb drug interactions. So it'll give you a nice little snippet and really helpful information to kind of point you in the right direction. And then lastly, I just wanted to mention that I do, in addition to the survivorship clinic with Smilow, I work on the Smilow Integrative Medicine program or team. That's run by myself as the registered dietitian, Dr. Sofer, who's the physician, and then a pharmacist on our team, Jess. And we look at the whole person, so it's a very holistic approach, but part of that is the supplements clinic. And if patients have questions or are taking many supplements and really need guidance on what they should be taking, what potentially could be risky, they can come to that clinic. It's free to talk to me, and we can really take an hour to run through all the supplements and just answer any questions that you may have. So if you're interested in that, you can look up the Smilow Integrated Medicine team on the Yale website and reach out to us to schedule an appointment.
And Natalie, can they talk to their providers about the integrated medicine clinic as well?
Absolutely. Absolutely. Bring it up to any of your Yale providers. They should be aware of this program, but it's always good to just I try to bring it up just so that it's not forgotten about. I think it's something that's really necessary because so many patients are taking these supplements, and just, it's good for you to have all the information and just know exactly what you're doing for yourself.
Great. Thanks so much, Natalie. And Bridget, I'll pass it over to you now.
All right.
For the next myth.
So our next nutrition myth is another big one, just after the one that Natalie talked about. So myth number 2, sugar feeds cancer, and I should eliminate all sugar from my diet. So definitely a myth. The truth is that sugar, which we also call glucose, and I'll talk more about that word, but it is 100% the primary fuel source for our body and our brain. From a dietary perspective, we do say added sugars should be limited in the diet. Notice that it's the word avoid is not used, but limited in the diet. And then other sugars or carbohydrates like fruits, whole grains, dairy products should absolutely be included. And take special note that the word limited is not avoided. We can have some added sugars. There is space in our diet for that. But the bottom line of that truth is that sugar, there's no evidence that sugar is going to feed cancer. So next slide. Okay, so again, glucose, which is another word for sugar. Anything that ends in OSE is a carb or a sugar, we can say. It's the body and brain's primary fuel source. We use glucose, the carbs that we eat, to brush our teeth, to go on a walk, to go on a run, to get in and out of our car, to think and process our things we're doing at work and conversations we're having with friends. We're using glucose for those processes. Again, main body and brain's primary fuel source. About half of our calories should come from healthy carbohydrates. So if we think if someone's eating 2,000 calories a day, 1,000 of those calories should come from a carbohydrate source, such as whole wheat products, fruits, dairy, some vegetables like corn and potatoes. And yes, we have some of those come from muffins or maybe a little bit of sugar we put in our coffee or something like that. But half of our calories ideally are coming from like the healthy source of carbohydrates and less added sugar. But again, just pointing out that a lot of our calories are from a source of carbohydrate. Again, bottom line, no evidence to support the claim that sugar feeds cancer. There are no studies that show us in humans that if we eat, if this individual eats 50 grams of sugar from cookies or dessert, and this individual eats 0, that the individual who ate 50 grams of sugar is going to have higher risk of recurrence or occurrence. No evidence. So however, we will say quality of sugars matter. So there's natural sugar, and then there's added sugar. And again, so next slide with that. So natural sugar versus added sugar. Something I'd want you guys to take away from this is that that there is a difference. We do want to limit our sources of added sugar, and we want to definitely enhance and eat sources of natural sugar. So I was mentioning that anything that ends in OSE is a carbohydrate. So there's glucose, there's fructose, there's lactose. I'm sure everyone has heard of lactose before. So anything that has natural sugar is a fruit, dairy, starches / carbohydrates, beans, legumes, and some veggies. So like corn and potatoes and green peas have a good amount of natural sugar carbohydrates. Black beans, kidney beans, lentils have a good chunk of their nutrition profile is a carbohydrate, but it's a natural sugar. So it's naturally in that item. Whereas added sugar, it's added during processing. So soda, candy, sweets such as muffins or baked goods, right? Desserts, those syrups that we might put in our coffee, or maple syrup or honey, those are added sugar. Doesn't make them bad. It's just we want to limit them and kind of pick and choose where we're going to put them in our diet. So that is the difference between, again, natural sugar versus added sugar. Next slide. So some labels, just to give you a visual perspective. So this is an example of something that has 0 grams of added sugar. It's just Chobani yogurt. It's plain. That's why usually it would have 0 grams of sugar. It's a plain, no flavor. It's non-fat Greek yogurt. So total carbohydrates, 7 grams. That's coming from lactose. Again, lactose is a sugar that's found in milk. We hear the word sugar, and we might say, if we're thinking about cancer and limiting sugar, oh my gosh, I can't have lactose. I see it has carbs, it has total sugar, it has 4 grams. But try to look at the next line. It says include 0 grams of added sugar. So this particular product has no added sugar in processing, but that total sugar of 4 grams is coming from lactose or the carbohydrate that's in a dairy product. Cheese and yogurt and milk all have lactose. Therefore they have some carbohydrates. But there's that difference. Whereas if you looked at another yogurt label, you might see includes 8 grams of added sugar. That just means it's flavored with some sort, maybe honey, or they've added some cane sugar, or a syrup that makes it, they add the vanilla flavor or the blueberry flavor. And that's okay too. It's, again, picking and choosing where you put your added sugar allowance of the day. And again, trying to choose the least amount of added sugar you can as possible during the day, but remembering that there's no evidence that's linking it to cancer recurrence or occurrence. Okay, next slide. This is another example of a Nature's Bakery fig bar. So nothing at all wrong with these. It's just for education purposes. Okay, so we have 38 grams of carbs, we have some fiber, which is a carbohydrate, we have total sugars, which is 19 grams. The sugar in something like this is coming from whole wheat flour. There's fig in here, right? It's a fig bar, that's fruit, that's fructose or a natural sugar. That's going to contribute to the sugar content. Then moving forward, they do this particular product, they add sugar. They put some cane sugar that's in the jam. Brown rice syrup is another word for added sugar. So it's just something to be mindful of. Okay, this one package of this has 14 grams of added sugar. Again, so just you're picking and choosing, you're recognizing like, okay, this has some added sugar, doesn't make it bad and it doesn't lead to cancer or make my cancer worse, but it's just, it's there, it's in there. And also noticing, looking at an ingredient list and being able to pick out and see where the sugar is coming from, if that would be something you're interested in. Next slide. So sugar resources, again, moving back to evidence-based, like the American Institute for Cancer Research, the American Heart Association, all evidence-based is saying is that to limit foods with added sugar. Again, it's not saying avoid, but so they have some nice, the AICR, that first bullet, the American Institute for Cancer Research, they have a great diet and lifestyle section, and they separate it into prevention and survivorship, and they have a nice dietary section that has pictures and things to include more of and things to include less of. And yes, on that list of including less of are sodas and candies, things that have added sugar, and then include more of whole grains and lean proteins in your fruits and veggies, more wholesome foods, natural, some that have natural sugar. And the American Heart Association has some nice articles about added sugar and Sugar 101. The Sugar 101 has other names that are listed in the ingredient list for added sugar, such as honey, raw sugar, molasses, malt sugar, invert sugar, brown rice syrup. There's a lot of other names for sugar that you want to be aware of. Again, to make it easy, you can look at a label and look at the includes grams of added sugar, and it will tell you if it also online information from a registered dietitian and not a nutritionist. You wanted to say registered dietitian. Avoid hashtags like fasting, detox, keto, sugar-free, because a lot of those types of diets eliminate large food groups, right? And that's not the best idea, whether there's chemotherapy or other treatment involved either way. So try to avoid those very black and white hashtags, or when you're searching things, it usually eliminates large food groups. And I think there might have been a question. Are we waiting for those, or?
Yeah, no, that's okay. Go ahead, Bridget. It's very topical. It's the question was, what is a good allowance for daily added sugar intake?
Yeah, so you want to try to keep it less than 10% of your total calories. So I know that seems like can be math, but if you could, if you have your amount of calories you might eat, or you talk to a dietitian about, hey, around where should I fall, 10% of that, 10% should be no more than that from added sugar. So, if it's of those calories, I usually will say if a food item in a serving has, less than 10 grams of added sugar, that's pretty moderate. If you want to get as close to zero as you can, without sacrificing like the happiness of your eating and things that you like to eat, right? So try to, the least amount, the best, but you want to try to be less than 10% of your total calories from added sugar, not from sugar, but from added sugar.
And Bridget, it's Natalie. I think the American Heart Association, I think they say 25 grams for women. So less than 25 grams per day for women and less than 35 for men.
Okay. That's
so
good to know.
That's probably more of an average. Obviously 10% of your calorie needs would be more accurate. But I think that's the number I use with counseling, just to keep it simple.
So I think in that example of the fig bar, what did it have? It had 14 grams of added sugar. So, if you're thinking 14 out of 25 or 35 for male versus female, it does add up quick. And, it's hard, and you pick and choose where things that you really love to eat, and you don't want to be miserable with your food choices either. So it's kind of like making a budget, and where are you going to put your fun foods and your added sugar during the day. And not every day is going to be perfect.
Well, thank you both, Natalie and Bridget. That was super insightful. And I know just from Survivorship Clinic, I can say there's so many myths we're debunking each Wednesday we meet with patients, and so many nutrition myths I hear from you, Natalie. So it's great that you guys are able to go through some of these. And without further ado, I'll turn it over to Scott.
Thanks, Javin. I'm going to do my best to hit cleanup here. I think I'm gonna continue though. I think I'm going to continue a theme that you've heard from Javin and from Kristen and from Bridget tonight, which is evidence-based. And so hopefully I'll be able to demonstrate some evidence-based approaches to exercise specifically. So one of the big myths that I always see, or a big question that that patients ask me both in Survivorship Clinic and in my outpatient PT clinic is that cancer survivors should not exercise. It's really interesting, actually. I actually just had a conversation last night with Dr. Katie Schmitz, who I consider as like the OG when it comes to exercise oncology. She literally wrote the book, Moving Through Cancer. And she wrote the American College of Sports Medicine guidelines for cancer survivors. She's known internationally. And I asked her this question. I said, why in 2023 do we still think that, where's this notion come from that cancer survivors should not be exercising? And she said, the media. And I said, well, what do you mean by that? And she said, every movie you've seen with somebody who's going through a cancer diagnosis, what are they doing? And I said, they're sitting down and they're not doing much. And she said, yeah, they're sitting down and they got a blanket over their lap and they're not doing much. You don't see them out on a bike, and you don't see them out, going for a hike and all of those things. So I thought it was really interesting, her observation that, that's how the media portrays people who have cancer. So that's how we're digesting that, we're streaming that, and that's what we're watching. And so I think maybe that's where some of these myths come from. So the truth behind that is that when prescribed appropriately, exercise and rehab, and I consider rehab to include physical therapy, occupational therapy, and speech therapy, depending on what your needs are, is safe, and it can help decrease the loss of function. And I wanted to note here, two different sources, one of which is from the American College of Sports Medicine. Dr. Katie Schmitz was on that board, to write the guidelines in 2010 and then updated them in 2019. So you have an organization just like the American Physical Therapy Association that's based on movement and based on exercise. And so, yes, so those guidelines are coming from exercise and rehab professionals. But now in 2023, we also have the oncologists who recognize this. And so they have updated their guidelines, their clinical practice guidelines to include exercise, diet, and weight management in the management of individuals with cancer. So it's not just the organizations that specifically deal with exercise and rehab. It's the oncology world that is recognizing this too. And they now have purposeful, defined clinical practice guidelines that specifically says that patients need access to dietitians and exercise clinicians who know how to work with individuals with cancer. So then as we move maybe on to the next slide here, Javin, the question again is, what exercise is safe? And, again, like who are you going to follow on Instagram and who are you going to follow on TikTok? Well, I think it's important that people make references to current guidelines and clinical practice guidelines, and evidence-based practice. Anybody that's out there that's saying you can cure back pain with one move, that is probably not evidence-based. It's never usually that simple, because usually one move does not usually cut it. But I also think that when you're looking at different resources online, the sensational kind of one size fits all is not necessarily the right follow. Instead, people who are going through progressive exercises, so instead of like being shot out of a cannon, it's progressive. You're building up, especially coming off chemotherapy, coming off radiation therapy. But again, we have the guidelines now that shows that exercise can help decrease cancer-related fatigue and can prevent muscle loss and bone loss. It can help with our overall endurance, right? To help our patients get their endurance back. And one of the things that I found from the 2019 updated guidelines from the American College of Sports Medicine is that it was much more specific as far as the symptoms and the situations that patients are presenting to us, including anxiety and depression. So when patients come to us and we hear this fear of recurrence and we hear this anxiety of, I'm afraid that the cancer is going to come back, we now have evidence that says, in addition to all of the good lifestyle changes, and in addition to proper nutrition, we now have evidence that says that exercise helps decrease anxiety and depression in cancer survivors, which I think is very, very powerful. So that's the reference that I've cited there for those guidelines from 2019. So that's the first myth. So the other big myth that I hear is that exercise will increase lymphedema. And again, this was something that had been perpetuated for a long time, just because there really wasn't any research out there. And it was Dr. Katie Schmitz and her team at UPenn back in 2009 that they published this landmark research study, and here's the reference here for that, that showed that, again, controlled, supervised, progressive exercise, right? Not doing anything crazy, not doing any exercise, so all of a sudden trying to, do your max bench press or whatever, but progressive and supervised. Not only did it not cause lymphedema, but it helped reduce the cases of lymphedema in patients who already had lymphedema. So this is where you want to seek out somebody who not just is a physical therapist or an occupational therapist, but somebody who has taken the extra step to become a certified lymphedema therapist, a CLT. So when you're looking for credible follows, you want to see, do those people have that extra step, right? That extra certification? because you know that they are practicing at the highest level of their profession. So if they don't have those letters after the end of the name, if they can't say that they are board certified in oncology, or they can't say that they're a certified lymphedema therapist, then you really have to be cautious in the information that they're putting out there, that they're posting. And so, right, here's the big question. How do we know it's legit? It's so hard. I mean, everything is coming at us so fast now, and that's what our society is in 2023. Everything is digestible. It's quick, it's fast, it's 140 characters or less. So how do you know? And I think that, and I use Dr. Eleanor Templinsky, who's a breast medical oncologist out of New Jersey, as a great example of somebody who puts out credible, evidence-based information. And she does it by sharing slides. She goes to ASCO, and she goes to the San Antonio Breast Cancer Conference, and she's there. She's taking screenshots of brand new research studies that are being presented for the very first time. And she's able to post those links to those research articles, right? So if somebody can't back it up, like somebody, and I forget who was it, was it Natalie or was it Bridget? Somebody said challenge them, right? So yeah, you see a post, go ahead, message them and say, where's your evidence? What article are you referencing, for all your claims? And if they can't come up with something, then that's probably not legit information that you're following. So yes, so I think a common theme here is, again, credentialing, knowing that, that these claims are not necessarily the most outlandish things, but, they're much more grounded. Is it a more objective versus a subjective approach? And are they able to back it up? Are they able to cite their sources? So I'd like to kind of wrap up our discussion tonight. We're going to open the chat up in a minute. But I actually, so ironically enough, I saw this quote on social media, and I think it does a really nice job of kind of summarizing, where we are getting our information from. And so this particular person, who is actually a breast cancer survivor herself, I think sums it up best when she says that for many patients, evidence-based means they know another patient who had that particular experience. And we have to be careful with that, in the research world, N, right, the letter N, you want a big N, a big number, to prove that you've had a lot of patients go through a study and that it's able to be reproducible. But in this instance, an N of 1 is not evidence-based. There's not enough research to back up the claims of one person's experience. So you have to look at these larger studies to see that, and to know that they're credible. And with that, I think it's time to ask us a few questions.
Thanks, Scott. That was great, as always. And we want to open up the floor to all of you and ask what questions you have for us. What myths or truths potentially that you have heard about and wondered about, to let us know about and see if we can help answer some of those. I'm going to go ahead and stop the share so you can see us. We did have a question in the chat. And this is going to be going to Natalie and Bridget. And either one of you feel free to chime in. Any recommended resources regarding antioxidants? Can green tea be bad for you? I've heard it thins blood and to limit intake. Thanks.
Yeah, I can take this one. We can probably tag team it too, Bridget, because I'm sure you have something to put in too. But it definitely depends on whether you're active cancer treatment or not going through treatment. You're not a cancer patient. It definitely depends on where you are in your cancer journey, if you are a survivor, if going through treatment. But in general, getting antioxidants from whole food sources is ideal. So instead of taking a vitamin C supplement or taking an acai berry supplement, eating the whole food, get some grapes, right? Eat some cherries, get fruits and vegetables of different colors, different varieties to get different antioxidants and vitamins in your diet. When it comes to green tea, I haven't heard about the blood thinning properties. There are other supplements that can increase risk of bleeding, lengthen time of clotting, but green tea, I don't believe is one of them. More the risk would be stomach ulcer, nausea, GI symptoms, affecting absorption of iron, that kind of thing. But in general, you can overdo green tea capsules. I have seen patients do way too much of those. But in general, 1 to 2 cups of green tea a day is considered totally safe and actually recommended as like a heart healthy diet and, disease prevention. So help with Alzheimer risk and all that. So there is definitely health benefit to green tea in the drink form.
Yeah, I think I don't know the exact number, but the amount of like tea bags of green tea you'd probably have to use to like be equivalent to like the capsules would probably be very excessive. So using, 1 to 2 green tea bags a day. And I don't know I think maybe with the blood thinning, like hearing if maybe there's some compound in green tea that people have heard, maybe it decreases blood clotting or something, or if it's related to heart health, maybe someone's reading like, oh, it helps, won't, thin your blood and not, decrease blood clotting, but
yeah.
Great. Well, that is really helpful to know about antioxidants, and to piggyback that, what you guys were saying, it's something that we've seen some data on with regards to during active treatment, avoiding those supplements that can increase the risk of recurrence and decrease the efficacy of treatment that people are on, the chemotherapy that people are getting to treat actively, for different cancers. So very good points there, and great question. Thanks for bringing up the antioxidants. Looks like we have another question here. Are artificial sweeteners safe to use? Another one for the dietitian team.
yeah, I think no, and Natalie, correct me if I'm wrong, but like no research studies that indicate that artificial sweeteners are going to increase risk of recurrence or cause cancer. There's definitely some cons. I mean, there's pros and cons to everything, but they can damage like the linings of your esophagus and in your stomach, so that some people can have irritation when they use a lot of artificial sweeteners in terms of like reflux or gastric ulcers. It can be bothersome that way. Some people find that they're sort of addictive. If they start to use them, they feel like they have to use more. So just like keeping that in mind. Pros, I mean, they're safe for diabetic use. People trying to monitor their blood sugars. And sometimes you have to use less of it to get the same sweetness as you would get from sugar, which some people like that too, using less, teaspoons or whatnot, to get the same sweetness.
Yeah, I think that's great, Bridget. I think, so far the FDA has said they're safe in, small amounts. I do think we have overdone them in America, specifically because of the number of diabetics and people trying to lose weight and cut out calories. And I do think, and I'm sure you do too, Bridget, that there's a time and a place for artificial sweeteners. But I do find in counseling that people are definitely abusing them in a way where they're trying to restrict the calories. But what's happening is they're not actually giving their body the nutrients it needs and the energy it needs. So the cravings actually go up.
Backfires. Yeah.
And because the artificial sweeteners they could be 100 times, 1,000 times sweeter than regular sugar. It's just kind of increasing our desire for sweet, and it's adjusting our taste buds to prefer a level of sweet that's just not achievable from regular table sugar or, and those types of things. So I think we recommend, or at least I do, I'm sure Bridget does, just eating the real thing, instead of having a sugar-free candy, have the real candy, enjoy it, savor it, and be done with it, right? I think if you try to do too much sugar-free, you end up eating a large quantity of that sugar-free product and then still looking for something else.
Yeah.
Yeah.
you
And I
end
think
up
there
maybe eating
wasn't
more.
there some research with erythritol recently though? Erythritol that's been in like gum, like sugar-free gum and candies. It's been around for, I think since like the 80s or 90s, but I think there was some research saying it was linked to heart disease in some way. So I think we're just learning. We're definitely still learning about all these, sugar alcohols and sweeteners and things that we really don't know much about yet. But I think we know what sugar does and we know we need to limit it. So I think just do the real thing and just eat it in moderation.
So there you go. You're learning a little bit more about artificial sweeteners, and as with anything, moderation is key. So we do have another question in the chat here. Could you comment on organic food versus non-organic? Keeping it live with the questions for you guys.
Do you want me to take it, Bridget, or you want to? We can both do this one.
Yeah. You start. Yeah.
Okay. So when it comes to organic versus non-organic, this is again a question we get probably all the time. And I think we realize when we go to the grocery store now, we're leaving, and no matter what we buy, our bill is $200 plus, right? So I think a major problem in our country and in others is that we're not eating enough of fruits and vegetables, period. So there is something called it's the Dirty Dozen and Clean 15, right? And that's a great resource to utilize so that you can look at what the pesticide content is. I think it's like per square centimeter or per square inch. They tell you what the best fruits this year would be to purchase organic versus not organic based on the pesticide content that was tested on that food. So if you're eating bananas, thick peel, you likely don't need to buy organic. But if you are eating something like a raspberry or something that has those crevices and corners and edges that can trap, bacteria, pesticides, I think it would be a better choice to choose organic in that way. But I definitely think bottom line is if you can't afford organic, it's okay. Just buy regular, buy frozen fruits and vegetables that are sometimes more nutrient dense because they're frozen immediately after picking. So that nutrient is locked in instead of being on a truck or a plane for, a few days getting to the grocery store. So I think bottom line, get more fruits and vegetables. Ideally, if you can afford organic, great. But it's not necessary to do for everything.
You're still going to get the same vitamins and minerals, whether you buy organic raspberries or non-organic, same calories, same, et cetera. Yeah.
Some people prefer to get like a veggie scrub, like a good veggie scrub instead. That might kind of ease some of the anxiety with that. So getting a good one and using, vinegar or something too, to kind of wash your fruits and vegetables, that could make you also feel better about purchasing the regular thing.
Great. So, go organic, don't go organic. Frozen fruits and vegetables are good. I like it. We're learning a lot here tonight. I think that's awesome. And thank you guys for all the questions so far. Does anyone have any maybe for Scott or for myself? A lot of them have been very nutrition related, so I think that's been really helpful. Oh, here we go. We got one here. Scott, I think this one's for you. Does muscle strength or flexibility respond the same way to exercise when undergoing cancer treatment?
That's a great question. And during treatment, a lot of the metabolic systems actually do slow down. And so that's why it's even more important to try to be able to exercise during active treatment to prevent that muscle loss, and to keep the cardiovascular system strong, to keep the pulmonary system strong. So yes, you're right. As you're going through active treatment, especially if you're going through chemotherapy, it can affect so many different body systems. It's systemic. So your muscles are affected, your vascular system's affected, organs are affected, and then by extension, all your muscles are affected. So you want to be able to try to move as much as you can, and that's why working with a physical therapist or an occupational therapist during treatment is so critical. One of the things that I've learned and what I do in my outpatient setting is to look at somebody's chemo cycle and to see when do they get chemo. Because I know that, usually a day or two after most chemo cycles, people kind of feel really, really tired. And so I'll say, okay, well, I'll give you some stretches to do at home. You don't need to do anything crazy on those days. But on your off week, I do want you to come in because I do want to challenge you. There's more evidence now that we can do high intensity interval training during treatment, and it's going to help prevent muscle loss. It's going to prevent the increase in fatigue. And so to be able to have somebody get on a step machine or get on a treadmill, and we're doing it controlled, I'm keeping an eye on it to see, how you're responding to it. But it's really critical to be able to maintain that muscle mass as well as your bone integrity as well. I mean, sometimes chemotherapy can affect, your bones. And so you want to be able to keep your bones healthy. The last thing you want to do is have a fall and break a hip while you're in the middle of active treatment. So yes. So the answer is yes. Active treatment can affect the muscular, the skeletal muscle system, the musculoskeletal system. So that's why it's really crucial. So much of the research was done post-treatment, and now we're seeing this influx of research for folks in the middle of treatment now, during the treatment phase. And we're seeing some really good benefits with that.
Very good. Yeah, so I mean, that's something that we are promoting all the time in Survivorship Clinic. And I'm sending people to Scott to talk about during their visit. It's, exercise during treatment and how important it is to keep up with strength and help with cancer-related fatigue, as he highlighted before. So, so important for that. But also, bearing in mind where you're at with that and being patient with yourself in that process, because it's important to recognize you're going through chemotherapy. Maybe you've had surgery, maybe you're having radiation soon. And those are things that have to be kept in mind as well. And something we preach all the time in clinic. Scott, I think I have another one for you here. What is the relation of exercise and lung cancer? Does it help expand the lung?
So that's a great question. And so the short answer is yes. The longer answer is that it being able to exercise helps with oxygen perfusion within the lung, which is what you want. You want to make sure that the remaining lung tissue that's healthy stays healthy during treatment. Javin, I think you've heard me say this before in the past, at other talks that we've done. Like, one of the most fundamental things that I think that I can help patients with, or that a physical therapist or an occupational therapist can help you with, is teaching you how to breathe. Right? We are a society now of chest breathers, right? We're over our laptops all day long. We're over our phones all day long. And so we're hunched over and we're not using our diaphragm anymore. Our diaphragm is a muscle, and we can train the diaphragm just like we train your biceps or your quadricep muscles. So often what I'll do is I'll start there, and to work on diaphragmatic breathing, to use the diaphragm to help expand the lungs, to be able to get a fuller breath, get better oxygen perfusion into those lungs, get the blood flowing. That's where I like to start for a lot of my folks, but and specifically for somebody, with lung cancer. Again, you want to do it in a supervised setting. I don't know that I want somebody to just try to go out and try to do marathon training on their own. I want to be able to assess your blood pressure, your heart rate, your respiratory rate while you're exercising, to see how you respond to that. So I think, there's definitely a place for that. And I would highly recommend that anybody who does have lung cancer, that you are exercising, but to be able to do it in a structured way is probably the best way to go about that.
But don't be afraid to talk with your oncology team about that, and maybe, go and see someone like Scott. or maybe Scott himself to talk about that and ways you can, incorporate some exercises into your own routine to help with that. We do have another question. It looks like we're going back to the nutrition topics here. And this one can be for Bridget and Natalie. Does excessive pomegranate juice interfere with chemotherapy or help shrink your cancer?
Yeah, that's a good question. I think, there's no data or studies that are going to show that the pomegranate juice or pomegranate pill will shrink cancer. And I guess too, like wondering what the excessive would be. And then since there are so many supplements, in terms of, I guess regular pomegranate juice is not a supplement, but if a patient asked me that in the outpatient world, I would probably look up on the MSK herb site and search pomegranate and see if anything popped up in contraindications of do not take when with chemotherapy or radiation or anything like that. But typically, a type of juice, 8 ounces a day is really totally fine, and likely will not interact with any sort of treatment. But as always, I like to check that MSK herb, and they might have pomegranate seed on there maybe, and always ask your oncologist too, or the pharmacist that's in your clinic or that your oncologist works with, because they would also have more detailed information, but also no data that the pomegranate juice would shrink or do anything with cancer.
Yeah, I second that. I think I believe pomegranate juice, not specifically with chemotherapy, but just like grapefruit juice can interact with certain cardiac medications. Yeah, I'd be worried about the pomegranate juice impacting like blood clotting, because I think it can interfere with warfarin, which is a blood thinner. So, there's other things, not just the chemotherapy that we would be looking at, but I do think, like you said, Bridget, what's excessive, right? Because we see so many times that patients will say, yeah, I'm doing some of this. And then when you really do the diet recall and we see what they're doing day to day, it's, 7 or 8 glasses of something. So too much of anything is not necessarily a good thing. So I would say if it was a patient during chemotherapy, just like you, Bridget, it's okay to have 1 glass of pomegranate juice. Maybe just eat the whole pomegranate juice or the whole pomegranate, because they're amazing, and put them on your oatmeal or, in your yogurt. They're great that way. But I would definitely kind of refrain from doing more than 1 with chemotherapy, just because of the unknown, so if you don't risk, potentially counteracting the chemotherapy if you're going through it. So just trying to separate that.
And I think another good phrase that I like to use, because there's a lot of quick fixes that Scott was talking about, things that are easy to digest information. If there were, things that were going to cure, shrink cancer and cause these massive turnarounds, we would all know about them. So I think that's a good thing to remember. We would be aware, the providers would be aware, and we would be promoting it. So it's not to say that anything you read is not accurate, but it's just recognizing okay, I think that this would be known if this was accurate.
Yeah, it's a great point, Bridget, and both of you guys highlight a lot of good things there. There's a lot of studies happening for a reason on a lot of specific topics. And if something's floating out there as common knowledge, so to speak, you can bet that would have been gobbled up by, professionals and experts in the field for sure. And so it's important to always, for anything specific or anything you feel might be, too much of something or sounds too good to be true, run it by your team, run it by your oncologist, run it by your dietitian if you see someone, a dietitian already, or run it by your rehab professional if you're seeing someone for PT or OT. Those are things you can do and we can provide answers for. And if we're not the best person to provide an answer, we'll find someone who can, absolutely, and get that answer to you. And I have another question that just popped up here. And Scott, I'm thinking maybe this will go to you. I can talk a little bit about this too, though. Sloan K has a podcast on exercise and cancer and indicated they are doing research. Any studies to follow at Yale, or where to look for new findings on types of exercise for increased benefits? So I'll start with, one study that's near and dear to us as a survivorship clinic, the LEAN study, which was the lifestyle, exercise, and nutrition study. And there was a second cohort to that looked at, early response to that intervention for people going through, chemotherapy. And we saw that not only were there improved outcomes surgically for people going through treatment and then going to surgery, but we actually saw that people felt better with less side effects coming out of it as well. They felt prepared for how to sustain healthy lifestyle behaviors coming out of it as well. And so it was a really powerful study we had here at Yale. And I think a very pivotal one for how we view exercise and nutrition around cancer treatment.
Yeah, and that that LEAN study has had several different iterations, like you said, Javin, and it seems that they've got some really good results in the sense of one of the big things is chemotherapy completion, right? Like sometimes the toxicities of chemotherapy can be so rough that the oncologists have to make this difficult decision that they have to either reduce the dose of the chemotherapy or they have to take out, this particular chemotherapy drug altogether, right? So therefore, if they're not getting the full dose of chemotherapy or if they're not getting this one particular drug, what does that do for their overall survival, right? So what Dr. Melinda Irwin and our dear friend Maura Harrigan, have been looking at over the years is that that one of the big things that they looked at, especially in the newer iteration of the LEAN study, is that not only is it decreasing the adverse effects, but it's helping patients stay on their chemotherapy regimens, which is then going to help with the overall survival, right? So that the fact that that one study has just like continued to grow and grow and have all these offshoots has been really, really, really great. So that's probably our the one that we're probably most proud of right now that's ongoing at Yale.
Yeah, so we're continuing to look at lots of different interventions and ways that people can do better while on treatment. And so that is something that can certainly be built upon in the future. So, we're looking forward to that. Before we wrap up here, we have about 5 minutes left, and maybe we can get you out of here a few minutes early. Use that time for some self-care and maybe have a good relaxing night off of that. But I want to, highlight another myth that I didn't get to, and I was hoping I had a chance to talk about briefly here. And it's something I hear a lot, both in the survivorship clinic and in the breast center. It's that, does stress cause cancer? And the quick answer, as far as what we know from the evidence, is no. There's mixed data at best, and a large amount of that data points to no. There have been several meta-analyses looking at the link between stress and cancer, with some of those other proposed mechanisms, that I mentioned earlier in the presentation as well, being linked to stress. But in terms of a direct correlation between stress and cancer, we don't have any evidence that it points to that. So I know it's something that's commonly asked, and I want to share that with everyone, that we don't have any direct evidence linking stress and cancer. Feel free to bring questions like that, questions you heard about tonight, those myths, questions about social media, questions about who to trust, on social media and what to be looking for. Bring those up to your oncology team and your care team, and ask them, hey, is this for real? Is this something I can trust? Or is this just another myth floating in the wind? So with that, I'll give you a few minutes back here. I want to thank everybody here, Natalie, Bridget, and Scott, and Renee for helping to manage things in the background as well. Appreciate all of you being here. Thanks to all of you joining us, taking the time out of your night. I put some phone numbers in the chat as well for the Integrative Medicine Clinic, for the Yale Survivorship Clinic, and forgive me, I wrote 20, it's 203-200-4584, 203-200-4584 for the Survivorship Clinic. We also accept self-referrals, so feel free to call if you're interested at all, and we'd be happy to see you. So thanks everyone again for joining us for the Smilow Shares webinar series during the National Cancer Survivors Day month-long celebration we have here at Smilow. We're so happy you could join us for all of it, and we hope you have a very happy and healthy evening and rest of the week. Take care and have a great night.
Bye.
Thanks, bye.